Registered nurses know better than anyone that our healthcare system is hurting. We see the dangers every day. It's registered nurses who juggle too many responsibilities when working short-staffed, all the while knowing a mistake could be fatal. It's registered nurses who see their clients, residents, and patients' care delayed or procedures canceled when there aren't enough RNs. Every registered nurse enters this profession to use their in-depth knowledge, skill, and judgment to give each patient their best outcome and improve our population's health. No registered nurse wants to see care suffering or risks to patients increasing. But with inadequate staffing practices as a norm and healthcare needs continuing to rise and become more complex, these are the kinds of situations registered nurses face every day. We have heard the concerns about our system from countless RNs, and the Registered Nurses Union is ready to work towards a real solution. Our patients need a solution, and so do RNs. Did you know registered nurses routinely work short-staffed? And at times, they're forced to work 24-hour shifts? It can be incredibly hard for a registered nurse to get a day off, even if that day is requested 6 months in advance, and it's to attend their own child's graduation or wedding. Registered nurses in this province worked over 240,000 hours of overtime last year. All of these factors are contributing to high sick leave, burnout, and low morale. It doesn't take an expert to know this is unsustainable. More than 3/4 of Newfoundlanders and Labradorians agree there aren't enough RNs to provide quality health care. Improper RN staffing is costing our province money. But there is a solution that makes sense for all of us. A solution for patients, a solution for RNs, and for government. More full-time RNs can save a lot. Last year, we spent $47 million on vital overtime and sick leave. Without more full-time RNs, we could spend the same amount this year, or more. Or we can invest in safer registered nurse staffing levels and create a more efficient system. After all, the research is clear. More RNs means better patient outcomes, earlier interventions, and fewer complications and readmissions. More RNs simply means a safer, more effective system. We need a core staffing review. We need change. Newfoundlanders and Labradorians know this. Registered nurses know this. The RNU knows this. For the health of our province, it's time we act. More full-time RNs can save a lot.